Hello everyone, this is Dr. Nikita Doot. I am a resident doctor in the Department of Psychiatry at Sir Ganga Ram Hospital, New Delhi. It is my great pleasure and honor today to be speaking to you all about one of the major mental health concerns globally, especially in today's time, which is depression. So in today's video, I'll be talking about what depression is, what are its symptoms, how do we go about the treatment, and how can we help somebody who is struggling with depression. So depression is a mood disorder. It is characterized by disturbance of mood at its very core. So the people who are suffering from depression might experience sadness and feeling low majority of the times. Although depression has sadness as a very important feature, but it is necessary to differentiate the sadness of depression from the normal emotional state of sadness, because we all at some point in life, after a minor or major setback in personal and professional lives, experience sadness. But the sadness of depression is very characteristic. It is feeling low most of the time of the day, and it is accompanied by certain other symptoms like feeling fatigued, lack of energy, not being able to enjoy things and activities which were previously pleasurable to the person. There is lack of concentration, inability to focus on work, and along with that there are sleep and appetite disturbances. People might also feel hopeless and helpless about their situation. They might blame themselves for everything which goes wrong in their life. They might consider themselves worthless. They might have ideas of guilt associated with certain aspects of their life. And in certain severe cases, there are death wishes and suicidal thoughts. It has also been seen that 90% of people who suffer from depression also struggle with anxiety symptoms. So although depression can affect anybody at any age, from children to adults to elderly, there are certain risk factors of depression. For example, it has a genetic basis to it. So anybody who is suffering from depression, there is an increased risk of depression in the blood relatives of that person. Apart from that, certain environmental factors like being exposed to prolonged stress in personal and professional lives, suffering from a medical illness, and having difficulties in job and career, having interpersonal relationship problems, losing a loved one. These are all risk factors of depression. Along with that, there is a biological basis to it, which says that there are certain chemicals in our brain which are called as neurotransmitters, which are responsible for regulating our thoughts, emotion, and behavior. And in depression, there is a dysfunction of these neurotransmitters. So once we have established that somebody is suffering from depression, it is very important to seek professional help from a professional mental health expert, a psychiatrist or a psychologist. We must freely communicate with them about the symptoms, about any other concerns and stresses that are going on in the person's life, so that appropriate treatment can be provided. There are various treatment modalities of depression, like antidepressant medications, and then there are therapy sessions which are available. The therapy sessions are basically individualized according to the needs of particular individuals. And these are important because one major aspect of depression is also cognitive distortions, which are distortions or faulty thinking patterns, which include focusing on the negative aspects of life, not focusing on the positive aspects, magnifying the failures and disappointments, and magnifying the achievements and the positive things and the good things in life. So also dichotomous thinking, like thinking in just black and white and not thinking of the gray side. So these are certain maladaptive assumptions and maladaptive thinking patterns which are taken care of in therapy. according to the needs of a particular individual. There can be cognitive behavioral therapies, mindfulness-based therapies, interpersonal therapies. Along with that, in some certain cases where the depression becomes treatment resistant, we can go with other modalities like ECTs, electroconvulsive therapies, RTMS, and discussing these therapies is beyond the scope of this video, but there are various modalities which are present in treating depression. So if we find anybody around us who is struggling with depression, it becomes our moral responsibility to communicate with the person and their family members if possible, and to ask them to seek professional help so that we can decrease the suffering of the person as well as improve the quality of life. And lastly, it is very important to understand that we must not carry any stigma associated with mental illnesses or mental health and the word psychiatry and getting treatment from a psychiatrist or a psychologist. These are way in the past, and we should all move forward towards a better future where we can freely communicate about our mental health aspects as freely as we communicate about other aspects of life, and we can improve the quality and lifestyles of individuals. Thank you.